So Clay here again with a 42-year-old female with scleroderma. Scleroderma is a hardening/tightening of the connective tissue. It's an autoimmune disease. So taking a look at this EKG, going over our steps as we've gone over in every video so far. So first taking a look at rate, so 300, 150. So a heart rate of just over 100, so borderline tachycardia, so we'll call it tachycardia for the sake of this video. Then taking a look at rhythm, looking at QRSs, there's a QRS for every P. Over in here you get some P wave abnormalities, you get some atrial premature complexes in V1 here, as well as V2 and V3 as well. But overall, we have sinus tachycardia. And then taking a look at the access using our 1 and AVF rule. So 1, we have a positive deflection. AVF, we have a positive deflection. So a left access deviation. Then taking a look at everything else. So you notice in 1, 2, and 3, you have some diminished QRSs. And we've talked about the low voltage Qrx complexes in other videos, but we haven't defined it yet. So for definition's sake, an amplitude of the entire QRS complex less than 5 millimeters in all the limb leads, so 1, 2, and 3 as in this case, would need to be less than 5 millimeters. So we meet that criteria in 1, 2, and 3 here. So we can say that this EKG has a low voltage QRS complex. And then taking a look at other things, over here in V3, you can see the electrical alternans that we've talked about in many of our videos. So you can see electrical alternans in pericardial infusion with somebody with pericarditis. You can see it with hypertensive heart disease, coronary artery disease, rheumatic heart disease, supraventricular tachycardia, normal ventricular tachycardia. The only thing it's not usually associated with is complete heart block. So in this patient, as we mentioned in the pericarditis video, you're worried about the pericardial infusion. So pericardial infusion often is fluid around the heart, which results in the low QRS voltage because the heart swings back and forth in this pericardial fluid during the cardiac cycle. And if this progresses, you can ultimately lead to cardiac tamponade, which causes in a hemodynamically unstable patient. And once you get to that point, you almost always have sinus tachycardia. In this case, like I mentioned, we have some borderline tachycardia. So, as far as an overview of this patient and pericardial infusion, so you typically see the low voltage QRS, you see the electrical alternans, especially if it's complicated by that cardiac tamponade, and you may also have other features of the acute pericarditis, such as the diffuse ST elevations, a patient that just doesn't look well, and the sinus tachycardia. So that's it for this patient, and thank you.